The best way for us to learn about the upper extremity is to begin at the very beginning, right up here. We'll start by looking at the bones of the shoulder region, the clavicle, the scapula, and the humerus. Then we'll look at the joints which let them move and at the muscles which make them move. Lastly, we'll look at the principal blood vessels and nerves in the region. First, the bones. The bones that connect the upper extremity to the trunk are the clavicle, or collarbone, and the scapula, or shoulder blade. The parts of them that we can feel beneath the skin can be seen in this dissection. Here's the spine of the scapula. Here's the clavicle. In the dry skeleton, here's the clavicle. Here's the scapula. The proximal long bone of the upper extremity, the humerus, articulates with the scapula at the shoulder joint. The scapula and clavicle articulate with the bones of the thorax at one point only, here, at the sternoclavicular joint. The lateral end of the clavicle articulates with this projection on the scapula, the acromion, forming the acromioclavicular joint. Apart from this one very movable bony linkage, the scapula is held onto the body entirely by muscles. It's thus capable of a wide range of movement, upward and downward, and also forward and backward around the chest wall. Looking at the clavicle from above, we can see that it's slightly S-shaped, with a forward curve to its medial half. At its medial end, this large joint surface articulates with the sternum. At the lateral end, this smaller surface articulates with the scapula. On the underside, massive ligaments are attached, here laterally and here medially. The scapula is a much more complicated bone. The flat part, or blade, is roughly triangular, with an upper border, a lateral border, and a medial border. The blade isn't really flat. It's a little curved to fit the curve of the chest wall. This smooth concave surface is the glenoid fossa. It's the articular surface for the shoulder joint. Above and below the glenoid fossa are the supraglenoid tubercle and the infraglenoid tubercle, where two tendons are attached, as we'll see. A prominent bony ridge, the spine of the scapula, arises from the dorsal surface and divides it into the supraspinous fossa and the infraspinous fossa. At its lateral end, the spine gives rise to this flat angulated projection, the acromion, which stands completely clear of the bone. The clavicle articulates with the scapula here at the tip of the acromion. This other projection, looking like a bent finger, is the coracoid process. Here's how the clavicle and the scapula look in the living body. Round the edge of the shallow glenoid fossa, a rim of fibrocartilage, the glenoid labrum, makes the socket of the shoulder joint both wider and deeper. This flat ligament, the coracoacromial ligament, joins the coracoid process to the acromion. Here's the acromioclavicular joint. Two strong ligaments, the trapezoid in front and the conoid behind, fix the underside of the clavicle to the coracoid process. There's very little movement at the acromioclavicular joint. As we've seen, the medial end of the clavicle articulates with the sternum at the sternoclavicular joint. Strong ligaments between the clavicle and the sternum, and between the clavicle and the underlying first rib, keep the two bones together, but permit an impressive range of motion, up and down, and backward and forward. Now let's see how the clavicle and the scapula move relative to the trunk. Upward movement of the scapula is called elevation. Downward movement is called depression. Forward movement around the trunk is called protraction. The opposite movement is retraction. This movement is called upward rotation. The opposite movement is downward rotation. In real life, these movements of the scapula are often combined. The range of motion of the scapula provides fully 1/3 of the total range of motion of the humerus relative to the body, sometimes more. Without this movement of the scapula, we'd only be able to abduct our arm to here. That's as far as the shoulder joint goes before bone hits bone. It's scapular movement that lets us get all the way to here. Now let's look at the shoulder joint. To understand the shoulder joint, let's get acquainted with the upper half of the humerus. This is the head of the humerus. The articular surface is half of a sphere. On the anterior aspect is a well-marked groove, known as the bicipital groove, because the tendon of the long head of the biceps runs in it. At the proximal end of the groove are the lesser tubercle and the greater tubercle. Because it's between two tubercles, the bicipital groove is also known as the intertubercular groove. Down here on the lateral aspect of the humerus, almost halfway down the bone, is a rough spot, the deltoid tuberosity. Here's the shoulder joint, also known as the glenohumeral joint. This loose sleeve of tissue which encloses the joint is the joint capsule. The capsule doesn't hold the bones together. It's quite a weak structure. What it does is to permit movement. The structures which hold the two bones together are muscles, as we'll see. Here's the tendon of one of those muscles. Let's look at the movements that can occur at the shoulder joint. Movement forward and upward is called flexion. Movement downward and backward is called extension. Movement away from the side of the body is abduction. The opposite movement is adduction. Rotation which moves the front of the arm towards the body is internal rotation. Rotation the other way is external rotation. Now that we've taken a look at the bones, joints, and ligaments, let's spend about a minute reviewing what we've seen so far. Here's the clavicle for an easy start. On the scapula, here's the blade, the glenoid fossa, the supraglenoid and infraglenoid tubercles, the spine of the scapula, the supraspinous and infraspinous fossa, the acromion, and the coracoid process. Here's the proximal humerus with the head, the greater tubercle and lesser tubercle, the bicipital groove, and the deltoid tuberosity. Here's the sternoclavicular joint, and here's the acromioclavicular joint with the conoid ligament and the trapezoid ligament. On the scapula, here's the glenoid labrum and the coracoacromial ligament. Lastly, here's the capsule of the shoulder joint. Now let's move on to look at the muscles. We'll build our understanding pretty much from the inside to the outside. First, we'll look at the deepest muscles, the ones that go from the scapula to the humerus. Then we'll look at the ones which go from the trunk to the scapula. And lastly, we'll look at the big three muscles on the outside which cover up almost all the others. Before we look at any shoulder muscles, we need to take note of the tendons of two long elbow muscles which arise very close to the shoulder joint and lie deep to everything else. They're the tendons of the long head of the biceps and the long head of the triceps muscles. The long head of triceps arises here from the infraglenoid tubercle. The long head of biceps arises, surprisingly, here from the supraglenoid tubercle. To get there, it passes inside the joint capsule and right over the top of the head of the humerus. Now let's look at the four short muscles which hold the shoulder joint together. There are three on the back, one on the front. The one on the front is subscapularis. It arises from almost all of the anterior or costal aspect of the scapula. Its tendon inserts here on the lesser tubercle. Subscapularis, acting alone, produces internal rotation of the humerus. Acting with the other three short muscles, it holds the humeral head and the glenoid fossa together, while other more powerful muscles are at work. On the back, there are two muscles below the scapular spine and one above it. The one above is supraspinatus. It arises from almost all of the supraspinous fossa. It passes under the acromion and inserts here on the greater tubercle. The tendon of supraspinatus runs through a tight spot between the acromion and the head of the humerus. There's a synovial-lined pocket, a bursa, here between it and the acromion. Supraspinatus initiates abduction of the humerus. The two muscles below the spine are infraspinatus and teres minor. Between them they arise from almost all of the infraspinous fossa. Infraspinatus here, teres minor here. Infraspinatus inserts here on the back of the greater tubercle, teres minor just below it. Both these muscles produce external rotation of the humerus. These four short muscles, subscapularis, supraspinatus, infraspinatus, and teres minor, converge on the humerus to form an almost continuous cuff of flat supporting tendons, often referred to as the rotator cuff. It's these tendons, together with the long head of the triceps down here, which keeps the head of the humerus from sliding out of its very shallow socket. There are two other muscles to note that also run from the scapula to the humerus, one on the front and one on the back. The one on the back is teres major. It arises here from the lower lateral border of the scapula and inserts here on the crest of the lesser tubercle. Teres major is quite a powerful adductor of the humerus. On the front, here's coracobrachialis. It arises from the coracoid process. It inserts down here on the humerus. Coracobrachialis helps to flex the shoulder joint. Altogether, there are 7 muscles that go from the scapula to the humerus, and so far we've seen 6 of them. The last one, the deltoid, is so big that it covers up almost everything else, so we'll leave it out of the picture till the very end. Now it's time to look at the muscles which hold the scapula in place and move it in relation to the trunk. There are 6 of them, 4 on the back, 1 in the front, and 1 underneath. The one on the underneath is the large and powerful serratus anterior muscle. This is just part of it. To see it all, we need to move the scapula away from the body. This big expansive muscle is all serratus anterior. It arises from the side and front of the first 8 ribs. It runs back under the scapula, and it's inserted all the way back here along the medial border of the scapula. When the whole serratus anterior muscle contracts, it pulls the scapula forward around the rib cage. That's protrusion. When its upper or lower fibers contract separately, they help to produce downward or upward rotation of the scapula. Now let's look at those 4 muscles on the back. One, the trapezius, is large and superficial. The other 3 are small and deep. The 3 deep ones are levator scapulae and the 2 rhomboids, rhomboid minor and rhomboid major. Levator scapulae arises here on the outermost point of the first 3 cervical vertebrae. It inserts here on the upper medial corner of the scapula. Levator scapulae helps to elevate the scapula. The rhomboids arise here from the 4th cervical to the 5th thoracic vertebrae. They insert here along the medial border of the scapula. The rhomboids elevate and retract the scapula. The large muscle which overlies these 3 is the trapezius. It's a beautiful but complicated muscle. The trapezius has an upper part, and a lower part, which both converge on the spine of the scapula. The upper part of trapezius arises from the occiput, and from the nuchal ligament, and from T1 to T3 in the midline. It's inserted along the upper edge of the spine of the scapula, around the acromion, and along the lateral third of the clavicle. The lower part of the trapezius muscle is not so massive. It arises from T4 to T12 in the midline. It inserts here on the lower edge of this part of the spine of the scapula. When the whole of trapezius contracts, it powerfully retracts the scapula. When the upper part contracts, it powerfully elevates the scapula. Last on the list of muscles passing from the trunk to the scapula is the one on the front. It's pectoralis minor. Pectoralis minor arises between the second and the fourth ribs. It's inserted on the coracoid process. Pectoralis minor produces depression of the scapula. There are two very small muscles to mention just for completeness. One is subclavius, which goes from the first rib to the clavicle. Its function is uncertain. The other is omohyoid, which arises from the hyoid bone way up here and inserts over here on the upper edge of the spine of the scapula. Its function is to depress the hyoid bone and the larynx. Now we'll complete our picture by looking at three big external muscles: pectoralis major, latissimus dorsi, and deltoid. Of these, the first two have much in common: pectoralis major on the front and latissimus dorsi on the back. These two are alike in that they both pass directly from the trunk to the humerus, bypassing the scapula. Between them, they define the posterior and anterior walls of the axilla. Pectoralis major arises from the medial third of the clavicle, from the front of the sternum, and from the front of the first 6 costal cartilages. It's inserted here on the anterior edge of the bicipital groove. Pectoralis major is a powerful adductor of the humerus. When its adducting effect is held in check by other muscles, it also produces internal rotation. Latissimus dorsi has a very wide origin. It starts here under the tail end of trapezius at T7 and goes all the way down to the sacrum and out onto the posterior iliac crest. It also has some fibers arising from the lower 4 ribs and occasionally from the tip of the scapula. It inserts here on the posterior edge of the bicipital groove. To get to its insertion, the latissimus tendon has to spiral around teres major. Here's teres major. Latissimus spirals from the back to the front, with the lowest fibers of origin ending up highest. Latissimus dorsi, like pectoralis major, is a powerful adductor of the humerus. Acting through the humerus, it's also a powerful depressor of the scapula, powerful enough to overcome the whole weight of the body, as in doing a push-up. Last of all, here's the deltoid muscle. It completely surrounds the shoulder joint, from the front to the back. It arises from the spine of the scapula, from the acromion, and from the lateral third of the clavicle. It's inserted here on the deltoid tuberosity of the humerus. The deltoid muscle has multiple functions. It's almost like 3 different muscles. Its anterior part is a powerful flexor. Its posterior part is a powerful extensor, and its lateral part is a powerful abductor. Now that we've seen all the muscles which act on the scapula and on the proximal humerus, let's review them. If you want to test yourself, turn off the sound. Here's subscapularis, supraspinatus, infraspinatus, and teres minor. Here's teres major and coracobrachialis. Now the muscles that arise from the trunk: serratus anterior, levator scapulae, the two rhomboids, minor and major, trapezius, pectoralis minor, subclavius, and omohyoid, and lastly, pectoralis major, latissimus dorsi, and deltoid. We've covered a lot of ground. I suggest you take a break before you watch the rest of the tape. Switch off for a while and start again in a few minutes. Now, let's look at the veins, arteries, and nerves of the shoulder region. As you'll see, the main bundle of vessels and nerves lies behind the clavicle and behind both pectoral muscles as it passes from the base of the neck to the underside of the upper arm. To understand how things are arranged up here, where the main vessels come up out of the chest and the main nerves emerge from the vertebral column, there are some key structures that we need to understand: the first ribs, the cervical vertebrae, and the scalene muscles. Let's take a look at them. Here's the first rib, below and behind the clavicle. This much of it is bone, and this much of it is costal cartilage. The two first ribs define the opening at the top of the chest, the superior thoracic aperture. The main artery to the upper extremity, the subclavian artery, crosses the first rib here. The subclavian vein crosses it here, right behind the medial end of the clavicle. Here are the vertebrae, the first thoracic with the first rib, and the seventh, sixth, and fifth cervical. Let's take the clavicle away so that we can see the vertebrae better. The main spinal nerves to the upper extremity emerge here, between the transverse processes. The spinal nerves that we're concerned with are numbered C5, C6, C7, C8, and T1. These two landmark muscles, the anterior scalene and the middle scalene, which are attached to the first rib here and here, guard the exit of these vital structures. The vein runs in front of the anterior scalene, the artery runs behind it. Between the two scalene muscles, the roots of the brachial plexus also emerge. There are two possibly confusing things that we have to live with. The first is that there's a nerve root named C8, even though there's no eighth cervical vertebra. The second confusing thing is that the main artery and vein change their names as they go along. Here they're called the subclavian vessels, here they're called the axillary vessels, and from here on down they're called the brachial vessels. The structures themselves don't change, just the names. Let's start by looking at the veins. We can be quite brief about this since the veins parallel the arteries in most important respects. It'll be helpful to start on the outside and progress inward, removing some muscles as we go along. Here, in the groove between pectoralis major and deltoid, is the cephalic vein coming up from the arm. It's a vein that doesn't have an accompanying artery. To see where it's going, we'll remove pectoralis major. Here's the cephalic vein. Together with other veins from the shoulder region, it joins the main vein of the upper extremity, the subclavian vein. We'll focus our attention on this important vein. The subclavian vein comes up from the arm and passes beneath pectoralis minor. Emerging from beneath pectoralis minor, it passes over the outer surface of the first rib. Here's the first rib, and under the subclavius muscle and the clavicle. To follow the subclavian vein further, we'll remove the clavicle, the subclavius muscle, and this muscle, the sternocleidomastoid. Here we are behind the medial end of the clavicle. which went from here, this is the cut end of the clavicle, to here. This was the sternoclavicular joint. Here's pectoralis minor. Here's the curve of the first rib. And here's scalenus anterior. These structures, the subclavian artery and the brachial plexus, we'll be seeing in a minute. Let's follow the vein. Just as the subclavian vein reaches the medial border of the first rib, which is here, it's joined from above by the main vein of the head and neck, the internal jugular vein. Together, the subclavian and internal jugular veins form the brachiocephalic vein. The brachiocephalic vein passes medial to the first rib and enters the chest. The dome of the pleura lies immediately behind it. Here's the pleura. To follow the brachiocephalic vein into the chest, we'll remove these muscles. And we'll also remove this part of the anterior chest wall. We'll also remove the other clavicle. Now we're looking inside the chest. Here are the divided ends of the two first ribs. And here's the divided end of the sternum. Here are the two brachiocephalic veins, the right and the left. A little to the right of the midline, they join together to form the superior vena cava. Apart from what we've just seen, the veins of the region correspond so closely to the arteries that we don't need to consider them separately. We'll move on now to look at the arteries. In the dissections that follow, all the accompanying veins have been removed to simplify the picture. To get a good look at the artery as it runs from here to here, we need to remove pectoralis major. Now only three structures stand between us and it. Here's the artery, passing behind the anterior scalene muscle, behind the clavicle, and behind pectoralis minor. Three names for one artery: subclavian, axillary, brachial. Let's see where it begins. Here's a deeper dissection with the chest wall removed. Here are the divided ends of the clavicle, the first rib with the anterior scalene muscle, and the second rib. In the middle, we're looking at the trachea and the common carotid arteries, the right and the left. On the right side, the subclavian artery arises, along with the common carotid, from the brachiocephalic trunk, which in turn arises from the arch of the aorta. On the left side, the subclavian artery arises directly from the arch of the aorta. In the early part of its course, as it passes over the dome of the pleura, the subclavian artery gives off some major branches, which we'll see in other parts of the atlas. These are the internal thoracic, the thyrocervical trunk, and the vertebral. In addition, the subclavian gives off two branches to the back and shoulder region. These are the transverse cervical and the suprascapular arteries. These two are variable. Sometimes they arise here, sometimes here. The main artery, now called the axillary, next gives off two branches behind pectoralis minor. They're the thoracoacromial and the lateral thoracic arteries. In the axilla, three more branches arise, often close together: the subscapular and the two circumflex humeral arteries, the anterior and the posterior. The posterior circumflex humeral winds round behind the neck of the humerus. Finally, the artery, now known as the brachial artery, passes on down the upper arm. Now let's look at the nerves. Between about here and here, the 5 spinal nerves unite and divide, unite again and divide again. The tangle which this produces is called the brachial plexus. It's not really too formidable. At the end of the brachial plexus, the 4 main nerves of the arm emerge: the musculocutaneous, the median, the ulnar, and the radial. In the course of the brachial plexus, the nerves which supply the shoulder region are given off. We'll look at the main components of the brachial plexus first, then at the local branches. Here's the brachial plexus, with several of its small branches removed, so we can see the big picture. We'll also remove pectoralis minor. Here are the 5 roots of the brachial plexus. They are in fact the ventral rami of their respective spinal nerves. They emerge, as we've seen, from between the anterior scalene and middle scalene muscles. The top 2 roots join, and the bottom 2 join, and the middle one, C7, stays alone. These 3 big units are called the 3 trunks: upper, middle, and lower. Each trunk divides. Here's one of them dividing into an anterior and a posterior division. Of the 3 anterior divisions, the upper 2 unite, and the lower one stays alone. The 3 posterior divisions all unite, as we'll see in a minute. Once that's all happened, there are again 3 big units, now called cords: lateral, medial, and posterior. They surround the axillary artery. The lateral cord divides to become the musculocutaneous nerve and 1/2 of the median nerve. The medial cord divides to become the ulnar nerve and the other half of the median nerve. This arrangement produces an M-shaped pattern of nerves: musculocutaneous, median, and ulnar. Now let's see the posterior cord. We need to remove the medial cord, the lateral cord, and the artery to get a good look at it. Here's the posterior cord all by itself. Sometimes it starts dividing before all 3 of its posterior divisions have united. Its principal branches are the axillary nerve, which we'll see again, and the radial nerve. Now that we've looked at the main components of the brachial plexus, let's look at the nerves which supply the muscles of the shoulder region. Some of these arise from the cords of the brachial plexus. Some arise in other ways. Let's look at the ones that arise from the cords first. We were looking at a simplified dissection before. Now we'll see the details. The medial cord gives rise to 1 local nerve, the lateral cord to 2. The one from the medial cord is the medial pectoral nerve. It's one of a pair. Here's its partner, the lateral pectoral nerve, which arises from the lateral cord. The pectoral nerves supply pectoralis major and pectoralis minor. Also arising from the lateral cord is the musculocutaneous nerve. It supplies 3 upper arm muscles, one of which we've seen, coracobrachialis. The other 2 we'll see in the next section. The posterior cord, here it is again with all its branches intact, has 4 branches. The axillary nerve runs round the neck of the humerus, along with the posterior circumflex humeral artery, to supply the deltoid muscle and also teres minor. The subscapular nerves, an upper and a lower, supply subscapularis and teres major. The thoracodorsal nerve supplies latissimus dorsi. Now let's see the shoulder muscle nerves which don't arise from the cords of the brachial plexus. Of these, 1 is the branch of a trunk, 2 arise from the roots of the brachial plexus, and 2 aren't part of the plexus at all. Arising from the upper trunk is the suprascapular nerve, which supplies supraspinatus and infraspinatus. Arising from the C5 root and passing through the middle scalene muscle is the dorsal scapular nerve. It supplies the rhomboid muscles. Arising from the C5, 6, and 7 roots, the long thoracic nerve emerges through the middle scalene muscle, runs deep to all 3 trunks of the brachial plexus, and supplies serratus anterior. Trapezius gets its nerve supply from the spinal accessory nerve. Lastly, levator scapulae gets a private nerve supply from the nearby roots of C3, 4, and 5. We've looked at some pretty complex and detailed anatomy in the last few minutes. Let's review what we've seen of the veins, arteries and nerves of the shoulder region. First, the few veins that we saw. The cephalic, subclavian and brachiocephalic veins. Next, the arteries, the brachiocephalic trunk, the subclavian artery, the axillary artery, the brachial artery, the transverse cervical and suprascapular arteries, the thoracoacromial, lateral thoracic, subscapular, anterior and posterior circumflex humeral arteries. Lastly, nerves, starting with the main components of the brachial plexus, the roots of the brachial plexus, C5, C6, C7, C8, and T1. The three trunks, upper, middle, and lower. Each trunk splitting into divisions, an anterior and a posterior. From the three divisions, three cords arising, the lateral and medial from the anterior divisions and the posterior from the posterior divisions. Arising from the lateral cord and the medial cord, the musculocutaneous, median, and ulnar nerves, and the pectoral nerves, the medial and the lateral. Arising from the posterior cord, the axillary and radial nerves. Also the subscapular and thoracodorsal nerves. Arising higher up, the suprascapular, the long thoracic, and the spinal accessory nerve. Understanding the shoulder region gives us a good foundation for understanding the upper extremity. In part 2 of the upper extremity, we'll take a long trip from here to here. And in part 3, we'll look at the hand.